ahead and shut the door. All right. Knock, knock. I'm Miss Jones. My name is Linda. I'm going to be your nurse. I'm going to be your tech. I'm going to be your RT. I'm going to do your vital signs. I'm going to empty your ostomy and your Foley, and then we'll go from there, okay? I'm going to go ahead and empty your ostomy first. Nah, this'll do. Be fine.
You guys should come over here so you guys can see.
Oh, this hair just gets in the way. You have a good day? That's awesome. Had some pudding for lunch, huh? Alright, let's just close that up. Oh, let's just. Neighbor, I'm gonna borrow these really quick. I'll bring them back, alright? Go ahead and clean this off so you don't get dirty. That'll be fine. Alright, I'll be right back. Alright. Ooh, you sound kind of gunky. I'm gonna go ahead and suction you, okay? Just gonna place this right here. Okay, RT does a wonderful job, so this was a sterile suctioning procedure, okay? Just notice where I place this. All right, let me go ahead and empty your Foley now. Oh, your urine looks great today. All right. I'll be back. Okay, are you ready to do your vital signs? All right, let's do this. I'm just gonna place this right here, okay? Let's go ahead and do your temperature. Ah, beautiful, no fever. Ooh, I better clean that. Let's see. That'll be fine. All right, let's go ahead and do your blood sugar. Give me just a second.
You guys can come over here so you can all see.
Can we pull the curtain back? Thank you. Yeah, I'm just
All
having
right, we
to.
just scan this. Get my strips. And then let me grab some supplies here. All right, perfect. Put that there. You write this down before I forget. And there it is. All right, well, everything looks great. Just put this here so I don't lose it. Is there anything else that you need? Oh, your yonker? Yeah, of course, I can grab that. Let me just throw this in the trash. It's my trash. Oh, you know what? I forgot to listen to your lungs. I'll do it really quick, okay? Perfect. Everything sounds great. Let me grab that yogurt for you. Oh, and your blanket's on the floor. Let me pick that up for you. Cover your little feet. All right. I'm going to go ahead and put that there. All right. Well, I will come back and check on you in just a little bit, okay? End scene. Sorry for the acting.
No, it was
So
beautiful. I thought you did it on purpose.
All right, Colette, did you want to give him the whole infection control part?
Sure. So about the glow germ?
The glow germ and just all of this.
So let's show the glow germ first.
Okay, so the reason for doing this, again, this is all the stuff that we have seen, visual audits, video audits, things like that. Just, you know, passing through the halls, this is just some stuff that we have seen, okay?
Pretty much, yeah.
So before we get started with the answers and stuff like that, I'll read all that for you. We're gonna look at the glow germ stuff, okay? This is just gonna give you an idea of all the germs that are all over the room and we don't even realize it, okay? One of the biggest things are the vital sign machines, okay? the techs usually do a pretty good job, and the nurses do a pretty good job of cleaning the handles, okay? But then they forget about the top. They put their hand there and they roll it down, okay? And this doesn't get cleaned as often. If you look at this, it gets really filthy, okay? Yes. All right. Another thing that you saw me doing over and over was the curtain, okay? The curtain, this is what it looks like every time we grab it. All of this stuff, just all over. And if you guys noticed, I didn't have my gown tied in the back, okay? So my big butt is rubbing all over this curtain, and I'm just getting all the germs all over me. And then I'm gonna go back to the nurse's station, and I'm gonna sit down in my seat. And when I get up, the next nurse is gonna come, and they're gonna sit on my seat. And then from there, they're gonna go to their patient's room, okay? So we just transferred it all over the hospital, okay? The containers, of course, you guys already know, these are disgusting as well.
Yeah,
All right.
I already did.
Yeah.
Overbid.
They're just dirty, okay? Another thing, the glucometers. Everybody does a pretty good job about cleaning them, wrapping them in, you know, the wipe and stuff like that. But again, you still carry a lot of germs. Just make sure you're cleaning that
You have to
appropriately.
scrub them
Yes.
and then wrap them.
Because you're dealing with blood. And you're just transferring that stuff from one person to another, okay? Another thing, the thermometers. Again, these are really dirty, very disgusting, okay? And the one thing that I've seen is that people clean the top, but they only clean the top with alcohol. Which is appropriate, yes, clean the top with alcohol, but use a wipe on the rest of it. All of this never gets touched. We did a session and I left this out to see, am I gonna come back the next day and see glow germ on the thermometer? And sure enough, I found glow germ on the thermometer. So always keep that in mind. Everything, this glow germ is just to kind of show you, this is where we transfer it and we don't even notice it, okay? You're not gonna see it. So again, just keep in mind. Another thing is the strips. Okay, taking them into the room, you're gonna have to leave them in the room. Okay, so best practice is to grab 2 of these, put them in your pocket, because if one fails, you already have an extra. Okay? Next thing, you're gonna see these little bags on all the vital sign machines. Okay? This is a no-no. For one, it's in a lab bag. It should not be in a lab bag. Okay, Jayco comes in here, they're gonna be really upset. Okay? But this is why you don't want to take these bags into the room. This is what it looks like every time. The lancets are covered in it and you didn't realize it. You have bed 1 and bed 2, you reach in there, you're just transferring this stuff. And remember, what do the lancets do? Right? It pokes them to give us some blood so we can do the blood sugar. Well, you just gave us a new entry for all this gunk to go in. Okay? So it's really important that we keep in mind about what we're touching and what we're transferring to other patients, okay? So that's pretty much it. Oh, no, it's not for the glow germ. If you noticed, I reached into my gown. That again is a no-no. This is why. It's all over my badge, okay? Same thing with my pens. Look at my scrubs, all from just touching. Patting myself down. I just contaminated my whole body. It's gross. And my hair, right? My hair is just swinging around. That's gross. If you're gonna go into a contact precaution room and your hair is down, it's cool if you want to be at the desk and have your hair down, fine. But when you go into a contact room or even a standard room, you don't know what you're gonna get on there. Put it up, okay? If you don't have a rubber band, just use a glove. If you, I'm gonna teach you guys a trick right now. If you just pull this little part off, the end of a glove, it turns into a rubber band. It's as easy as that, because I forgot my rubber bands before. Okay, there's ways around it. What we're doing here is we're really trying to open everybody's eyes to see what we're passing along from patient to patient, okay? So that's that. Can you guys tell me a couple of things that you guys noticed in the room? What are some things that you guys noticed wrong with the
The
room?
bags on the floor.
Yeah, the foley's on the floor.
Did you use alcohol wipe on her finger before you poked her?
That I did,
Because I didn't see that.
but where did I put my stuff?
On her.
Yep, I threw it on the tray.
Yeah.
Yeah.
Next to the urine.
Mhm.
And
There you
white
go.
bread.
Another it's gross. You
the
gotta change
blood
your
And then they're not
ones,
labeled,
and
so
doing
they don't know if
everything,
they're-
Right.
between emptying things and doing the blood sugar and sectioning.
Yep.
Your gap. and-
Her blanket was on the floor and you just picked it up.
Sure did.
Borrowed wipes
Listen
from
to
the
it when you
neighbor.
didn't have a gown on.
Yes. So borrowing wipes from the neighbor, that is a big one. And I'm gonna tell you why. We have always been, I don't know, haven't been on the floor in a long time, but the practice was to throw all the stuff and stock up the rooms and leave them in the middle, right? Because it's easier. Now, if there's a wipe open, you don't know who that belongs to. There is no name, there's nothing on there, and you're transferring it from one patient to another. Remember, you just cleaned their butt and you closed it with your dirty gloves. Exactly. So the best practice is take in what you need, okay? And say you didn't finish all the wipes and you only need like one or two. Put it on the patient's bedside table, put it in their drawer, or put their name on it. I mean, I wouldn't recommend putting it back in the middle, but you know, keep it to themselves, okay? We're really trying to cut down on that. If you guys noticed, first off, I left the room without even taking my
Changing
gown
gowns
off.
or washing
I
your
didn't, yeah,
hands.
I didn't change nothing.
You didn't change your mind once.
Nope, I didn't. I just kept going. Because it's too time consuming, I ain't got time for that, okay? Change your gloves in between patients. Even if you have bed 1 and bed 2, change your PPE.
Not
okay?
just in between patients, but in between procedures.
Yeah, how many times should you have changed your gloves?
I can count. Maybe like 20, 30 times.
Yeah, every time
Is
you
that
did a
theme
different
park that you
thing.
went to? Is that?
Oh yeah, that was my,
Okay.
yeah, that was my room. So that kind of shows in like the ICU. We were reviewing cameras on PPE. Well, we saw somebody walk out of a contact room, full gowns, gloves, and a big thing of urine. Took it to the dirty linen, dumped it out, and came back. Well, all those germs got spread throughout that whole place, just walking there and back. Does anybody know the way to do that without messing up contact, infection control, contact precautions? How should you do that?
Call for help. Cause they're at the
Yeah.
ICU, they usually say,
That
Change
too.
your gloves,
But-
walk out.
Yeah.
Say nobody's at the
And
desk,
then-
yeah.
Yeah.
Yeah, you have to take everything off and then.
Yeah.
Exactly. Put it on the floor, take all your stuff off in the room, throw it in the trash, sanitize, put some new gloves on, grab that container, go take it to the dirty closet, yeah, dirty utility, throw it in there.
But you're still
Come
punching
back.
in the code. I hate that whole system.
Yes.
The whole
So,
system needs to be thrown out.
Well, they actually say, if you want to get that specific, is using one glove.
Yeah, I mean, it's,
Yeah.
well, I mean, just carrying
And
the
with your-
canister down the hall
Yeah,
is
it's
just.
But with your
Your hand.
ungloved hand,
Yeah, you
yeah.
always have one dirty hand, one clean hand. You're not
Yeah.
gonna.
I just do it with both hands.
yeah, it's not a very good system, but we gotta work with what we have, okay? So that's why it's really important that everybody does hand hygiene. I know you guys see us, watching you guys, if you're doing hand hygiene, that's why it's really important, okay? If you touch those buttons, you should probably wash your hands.
I
Wash
say
your
it
hands
again.
afterwards, okay? Yes.
Every time.
But once you've dumped it out, you go back, place the empty canister into their room, okay? Then gown up, glove up, and then go and put it away, okay? Another thing, what did you guys notice about these canisters?
They're dirty and gross and not labeled.
and
Yeah.
they're
And
left
next to the
on.
food.
Next to the food, of course, that's a no-no. We don't want to do that. These are not labeled, like you guys said. We should know when to change them. Does anybody know how often we should change them?
I don't.
At least every 24 hours, okay? If not, once it's shipped, if it's looking disgusting, toss it out. Like, if we gotta order more, where's Mercy? She just left. Mercy, we need more. We'll get more, okay? But it's really important that we're not transferring. And then what did I do? I used this for both, right?
Yeah.
Again, a no-no. That's why it should be labeled. This is for my ostomy. This one's for my Foley, okay? Label it. If it looks gross, again, toss it out. Now this has no label on it. So I don't know what it's for, anything like that. So please label your stuff. The wipes, again, I got poop all over that. Gross. Go give it back to the other patient. No. Quick mention, now that I see this, these, please make sure they get into a sharps container. The kitchen is not equipped to have these on their trays, okay? That's very dangerous for them. You know, what if the patient has HIV or whatever? and the kitchen staff doesn't see it, they poke themselves, and now they have to go through a long, drawn-out process of getting their blood drawn every so often. Prophylaxis, all this, okay? Just make sure these get to the sharps container. What else? Oh, my lovely ventilator, okay? Make sure you guys are keeping these clean. Nothing should be stored on top of them. Now, if you're going to use them for a short period of time, you know, as a quick table, what should you do? Wipe it down, okay? If you're gonna use the table, always try to make sure it's tidy. Nobody wants to see a mess. It gets overwhelming for the patients. They're sitting there watching this mess all day. Clear it up. Make sure you wipe down the counter, okay? Make sure you wipe it, and then you can put stuff on there. Not a big deal. Now, I use the patient as my table. Again, not a good practice, but hey, these rooms are small, they're tight, you do what you gotta do. I know this for a fact, okay? But what did I do? I emptied the ostomy here, and then I went to suction right on top of that spot. Now, if it was a real RT and I left the room and they didn't know I did that, and they come in to do their suctioning, they didn't know that it was dirty. So you're gonna use that spot, okay? So just keep those things in mind. Using the patient as the table, not good because of that. However, if you have to, space is tight, put a barrier down, okay? It can either be a Chucks or it could be a paper towel, okay? Just make sure there is something between your supplies and your patient, okay? Another thing about ventilators. Before RT started cleaning their ventilators, can you guys tell me who cleaned them before?
Housekeeping?
No.
Nope.
No.
That's what we all think, right?
Yeah.
Housekeeping takes care of that. Well, they're not allowed to touch medical equipment, okay? They can't wipe it down because what if they accidentally hit a button? That patient stops breathing. You know, they cannot be held responsible. So who cleaned this before? Nobody. Unless you did it yourself, it did not get done. Same thing with the nurses, your pumps. EVS does bed rails, but you just change somebody and you have all their dirty stuff on there. Give it a quick wipe. It only takes a couple of minutes, okay? So yeah, before that, nobody cleaned them. RT, clean your vents. Nurses, clean your equipment, okay? Your pumps and everything like that. If somebody's changing somebody, you know, they just wipe their butt and they're like, oh crap, we forgot to pause it. You pause it with a dirty glove, and then the nurse down the hall hears it beeping and they go in there to unpause it. They just touched the contaminated pump, okay? I personally would do it twice a shift or at least once a shift. When I'd get on, when I was doing my first med pass, my countertops would get clean, my bed rails would get clean because I know I'd have to lean over sometimes to grab something while my scrubs are gonna be dirty. So clean your pumps, clean your surroundings, okay? So just be conscious of that. Paulette?
Stethoscope.
Oh, the stethoscope. Oh my goodness, I'm so bad. I took my gown off and then I remembered, oh, I have to do this. Well, I just contaminated myself. This thing's covered in germs. Now, if they're in contact precautions, we highly recommend that you use the stethoscope in the room, okay? They're disposable, they're for that patient specifically. Now, if there's two hanging and you don't know whose it is, go get a new one, okay? If you are going to choose to use your own stethoscope, because I know those ones are not the best, especially for lung sound, you can't really distinguish. Just clean your stethoscope, okay? Please, because you take it from one patient to the next, okay? Make sure these are clean. All right, Colette, what else do we need to discuss? What
No,
else
it's
do we
just
bring
important to use the barrier. It doesn't have to be a Chucks. It can be a paper towel or whatever. Whenever you put supplies down, it's supposed to be on a table or surface that's been disinfected. And whatever you're doing, med pass, you know, the respiratory stuff, glucometer, vital signs. And don't take your clipboard in. And or pens, we recommend you chart in the room.
Yeah, so the clipboard, I know we see the text going in with them. We're trying to really push them away from it, charting in the room. You can sanitize this part, but you cannot sanitize your paper. And you're just transferring it from one room to the next, okay? We did have a tech go out and see if she can function without her clipboard. Before we try to ask everyone, don't bring in clipboards at all. She did it. She said the first couple of days were kind of rough, but she actually started liking it because she wasn't attached to this thing. And the nurses didn't have to hunt her down because, for one, she'd write it on her board so the nurse can see it, and then she charted in the rooms. So it was in the computer automatically, and she's like, they never come and bug me for vital signs because they're already in there. So nurses too, when we go give a report, we have our S bars out and we're just kind of, you know, checking all the lines, tubes, and drains. Well, your paper's still in that room. That's why we're recommending use your computer. That S bar is in the computer. Everything that you need to know is in there. Okay? As long as you're up to date on your charting, it's everything you need to know. So try not to bring this stuff in. They're trying to get pens in all the rooms. Josiah's working on that. Just so if you do need a pen, it's there. Okay? And you don't have to go digging through your pockets because as you see, it's disgusting. All right. Anything else?
Mm-mm. Do you want to look at those papers?
Oh yeah, my answer sheets. Maybe. We talked about most of this. So meal tray and urinal on the table, bedside table in general, make sure it's clear and wiped off. High touch surfaces, we touched that. Vital sign machines, all that stuff. Curtains. The curtains are very disgusting because they're cloth. We're working on getting plastic ones, okay, like this, because you can wipe these down. And at least we feel a little better you know, they're clean. Sharing patient-specific items like wipes, we already talked about that. It's a no-no. Not dating and labeling, not rinsing off the canister. I didn't even rinse it out. I just kind of I was like, it'll work. Okay, make sure you rinse those out. Dating and labeling everything pretty much. Linen on the floor. Now, if the linen falls on the floor, just replace it. Okay. It's very rare that during day shift we run out of linen. It has happened on night shift before, but you know, watch your blankets, make sure they don't go on the floor so you don't have to cover them in towels. Do what you gotta do. Now my yonker, it was on the floor, right? That's gross. Replace it, okay? Now, you see these patients putting it under themselves. For one, pressure injuries. Red flag right away, not good, okay? Second thing, it's just really gross because you see a lot of them put it like on their butt and stuff. I mean, they're sweating in a bed and then they're getting that yonker and using it for their mouth. That's gross. So those are the things, that's how you got to think about this stuff, okay? Now, how to store it. There's a couple ways. I mean, you can hang it off of something where it's not touching the floor. Make sure the cover is pulled. I mean, it's as simple as grabbing a patient items bag, just tape it to the side, and then they have a place to put it, okay? Just remind them, don't use it as a trash can and a holding place for your yonker, because again, that's gross. Going from clean to dirty, not changing gloves, we already talked about that. Please change your gloves between your procedures. It's as easy as taking them off. Using some sanitizer, talk to the patient while they dry, throw on a new pair, okay? Contaminating multiple surfaces, we already talked about that. I jumped everywhere, I didn't care. Ostomy, vital sign machine, we talked about all that. Make sure those are cleaned really well. We talked about the PPE, make sure it's tight in the back. You know why now, right? Touching your hair, pin it back, contaminating my bag, let's see. Reaching in our pockets for pens, let's not do that. Oh, another thing I forgot to do in our little skit, the phone. If it rings, just try to silence it with your gown, okay? Like, don't pick it up out of your pocket because now it's just contaminated. And you're gonna forget to clean it off because you're not used to that. You're gonna hold it up to your ear and now your face is all contaminated. Those of you with glasses, you know, it's hard because they start slipping when you're going like that. Well, you're still dirty and you're still getting it all over your face, okay? So just keep those things in mind. Talked about that. All right, if there's not anything else to add, I hope you guys enjoyed it. I know I was a little dramatic and my acting is not up to par, but I hope you guys had fun and I really hope you guys took some stuff away from this and that we see it on the floor and we see you guys